The positivity rate of the National Capital Region has once again decreased, according to the Octa Research Group, which is in stark contrast with other areas of the country that is seeing an uptick in the said COVID metric. An expert believes that even if the Philippines has not reached the endemic stage of the global menace yet, we have made it to a point wherein the dreaded disease is already manageable given the appropriate level of awareness and precautionary measures. Mark Fidalgo has more.
The Department of Health said the Philippines has not detected the new Omicron subvariant XBB. This after reports in other countries saying the XBB is said to be driving infections in Singapore and Bangladesh. According to the DOH, the XBB variant is a recombinant of BJ.1 and BM.1.1.1 and shows higher immune evasion ability than BA.5 based on preliminary studies. The Health Department also assured it is continuously conducting surveillance to monitor the importation of the said variant and other emerging SARS-CoV-2 variants. According to Octa Research Fellow Dr. Guido David, the threat of new variants is one of the reasons why the public still needs to continue to take extra precautions against COVID-19 despite the decrease in positivity rate in Metro Manila. David said the positivity rate in the NCR dropped from 17.9% to 15%.
Minomonitor natin itong mga bagong subvariant, yung BQ at yung BA2.75.2 na very similar in characteristics nila, highly immune evasive, antibody evasive. So kahit na nagkaroon na ng prior infection, pwede pa rin magkaroon na mahawaan.
However, the Octa said the positivity rates are very high in Camarines Sur, Cavite, Laguna, Rizal, South Cotabato, Tarlac, and Zambales. The group attributed the rise in positivity rates to the increased mobility of people and sense of complacency. Meanwhile, asked if the endemic state of COVID-19 in the country is in sight, David said,
"It's possible kasi in terms of yung number of cases naman ay tumataas at bumababa. Hindi naman necessarily endemic, pero I think we're able to manage the pandemic at this time dahil sa continued nasabi niyo kanina, Aljo, continued vaccination, continued boosters, yung improved healthcare natin, improved treatments against COVID. So yung management naman yung mahalaga.
The World Health Organization said it is clear the COVID-19 situation has evolved and quite different to the time when the virus was declared a public health emergency of international concern. It added that the global community has all the tools it needs to end the health crisis in every country.
The pandemic is not over, and there is much more work to be done. WHO will brief the committee on the current situation globally and present our concerns about the continuing risks to the world's population with large vaccination gaps, reduced surveillance, low rates of testing and sequencing, and uncertainties about the potential impact of current and future variants.
Mark Fetalco for The Nation.